My fellow Singaporeans, good evening. COVID-19 is the most serious health crisis the world has faced in a century. We have all seen the devastating effects of the virus worldwide. When the outbreak gets out of control, the spike in cases can quickly overwhelm the healthcare system. Many people will not get the care they need, and the number of deaths will rise sharply. We are determined to avoid the same fate in Singapore. That's why we've been going all out to control the spread of the virus and to ensure that our healthcare system is able to care for all who are infected. It has been a tough fight against a formidable and invisible enemy. We've had our share of challenges, but we faced them head-on. Working together, we've stabilized the situation in the migrant worker dormitories. We've brought down community cases significantly. We've protected our seniors and kept our fatality rates low. I thank everyone for your hard work and sacrifices in keeping our fellow citizens safe. Most of all, I would like to acknowledge all our officers serving on the front line, including our healthcare professionals and volunteers. I'm speaking today at the NCID, the National Center for Infectious Diseases, which has been at the forefront of this battle. You have all been working flat out, making daily sacrifices and exceeding the call of duty. So to all of you, I want to say a big thank you. The strict measures and restrictions we've imposed over the recent months have been effective, but they come at a high price. We are cushioning the impact on our businesses and workers with 4 budget packages this year. But we cannot remain closed indefinitely, as we have to prioritize both lives and livelihoods. And that's why we've embarked on a phased approach to reopen safely. But please understand, we are not going back to life before the circuit breaker. The vast majority of our population have not been exposed to the virus and are still vulnerable to the disease. We want to continue to provide maximum protection for our seniors and those with medical conditions. Hence, we've been very cautious in our reopening. We are now in phase 1, and we will continue to monitor the situation over the coming week. If the conditions remain stable, we will be able to move into phase 2 before the end of the month. We will then resume a broader range of activities covering nearly the whole economy and allow social interactions and family visits in small groups of not more than 5 people. Externally, we are carefully easing travel restrictions and reopening our borders